being seen by several hundred people, but it's all good. But it's good news. The clinic is now officially under the agreement of Generational Clinical Partners, Dr. Lynn and Marcia and Dr. Faytag. And many of you will recognize Dr. Lynn as he has given education sessions here during our COVID days. So you'll see a familiar face with him. On the clinic and independent living, if you would like to make an appointment, just contact Denise as usual, and she will have the schedule and she can schedule you accordingly. So nothing about scheduling your appointment will change because Denise is going to stay with us at the clinic, which is very great news, and there's been a lot of excitement for keeping Denise here as well. So we are going to have just a short introduction. Dr. Lynn's going to introduce the team, and then a Q&A, question and answer. And then we have cookies and looks like maybe punch in the back of the room so that you can have some informal time with the physicians and nurse practitioner to ask questions that you may have that's more confidential outside of a larger forum like this. So with nothing else to say, Dr. Lynn, it's all yours.
Well, thank you, Lynn. It's great to be back, and I always love coming back here. For the past few times, you guys have seen me kind of give some informational sessions about COVID, but today I'm here mainly to share a bit about our medical practice, its history with Meramec Bluffs, and then get out of the way and let Dr. Faytag and Marcia introduce themselves. So, as Lynn said, I'm Walter Lynn. I'm the founder of Generation Clinical Partners. We are a medical practice that started back in 2014, so about 8 years ago now, with the vision of specializing in the care of seniors who are living in senior living. You know, the kind of philosophy behind our practice was that here in communities like Meramec are a lot of people who live here with increasing age and chronic conditions, often some impairments like functional impairments and cognitive impairments, which is the reason why they're living here, and who have a very hard time getting out to see their physician in clinic. So the philosophy behind Generation was to bring the medical team to the community and provide medical care on site. We just thought that this was a really important thing to do. As people know, as we grow older, and, if we grow old enough, everyone's going to experience this. As we grow older, people probably heard, we grow more frail, right? And what does frail mean? And I just thought maybe I'd spend a minute or two describing that and kind of how that ties into our philosophy of care. So from a medical perspective, frailness means that as we grow older, our body ages and loses a lot of biologic reserve to counter conditions that might happen to us, like a urinary tract infection, like maybe a heart failure exacerbation. And so what happens is, as we grow older, because of the decreased biologic reserve, small things can tip us over more easily into a big thing that could land us in the hospital, right? And so the thinking was that as people grow older and develop frailty, they often need more responsive medical attention to provide better care and catch things when they're small, treat them when they're small so that they don't have to wind up in the hospital. And people who've been to the hospital know that after a hospitalization, often there is a rehab stay that follows, so you're out for like weeks sometimes, if not longer than that. And wouldn't it be great if we could prevent that whole cycle from happening by providing on-site, responsive, expert medical care? So that was really kind of the philosophy behind our practice and its a founding. We decided to only specialize in the care of seniors in senior living. So none of us here have an outside clinic. We don't go to any hospitals because we really want to just focus on being present in our communities and taking care of our patients here to provide that responsive care that I was just describing. I'm happy to say that actually when we first started this practice 8 years ago, Meramec Bluffs was our first partner, and we've been here ever since, and we've just really enjoyed the relationship, appreciated how it's grown, and we welcome the opportunity to help take care of some of the patients that will be needing a new primary team once Dr. Usry and Jenna have to leave. And so we work with all hospital systems. We, in the sense that we communicate with specialists from the different systems across St. Louis. We're very used to that. And I think the whole idea of just kind of being on site, being present, being responsive is very core to our model of care. So that's really it. My job really is just to kind of describe a bit about our practice, and then maybe I'll ask Dr. Fatak to come up, share a bit about herself, and then Marcia afterwards, and then we'd be happy to take any questions. All right.
Can you hear me okay? Great. Oh, I'm going to keep it on if that's okay, but I'll speak as loud as I can. Is this okay for you? Great. Well, I didn't expect to be doing public speaking, but this is lovely to see. What a wonderful turnout, and hello to everybody on live stream. My first name is Serena. My last name is Fatak, and I'm a St. Louisan, born and raised here. I went to medical school in Kansas City and then did residency at St. Louis University. And it was a while ago, but back at the time, SLU was one of the first hospitals that pioneered a geriatric unit. So from that time on, I think I just developed a love for the care of this patient population, and it's been really lovely. I met Dr. Lin in 2018 and have been a happy member of Generation Clinical Partners since then. Have been here at Meramec Bluffs also since 2018, and maybe you've seen me here. I've been lucky enough to take care of several independent living residents who may have had an injury, a fall, or some sort of an event that required a hospital stay and then a maybe short stay on reach. And nothing makes me happier than to watch somebody recover from an incident, get strong again, and be able to get back home and live and thrive. So we're very excited to be able to take part in the clinic side over in the independent living half of the campus. I did get to meet with Dr. Usry this morning. It was my first time getting to meet him, and very lovely. We had an exchange of phone numbers, and hopefully any communication will be seamless. So both of us are very open to making sure that we get to know all the information we need to hand over all of our patients without any issues. Any questions or anything I can answer, please? And maybe even a little bit sooner. We're already here all the time, almost every day anyway, seeing patients in the care center and on reach. And we're working on getting a more set schedule over for the independent living side. It shouldn't be too different than what he has right now. And Denise has been just instrumental in making sure that our coordination and communication is staying on track. I did hear you.
Okay, I was just curious. Are you going to be here like Jenna was versus just a half a day like Dr. Usry? How is that going to work?
I think it'll be very similar to what Jenna was doing. And if we're there for half days, we still have some flexibility to work out if that'll be a morning or an afternoon. And then because Marcia Johnson, who you'll meet here in a minute, it will be here more during the week, there's also some flexibility for an emergency visit or should things come up along the way.
Yes, Dr. Usry's my primary care physician, and I'm going to need to change primary care physicians. Is that something Denise can help me with?
Absolutely. We're happy to help
Okay.
with that as well.
And then a second question, I have a Medicare Advantage plan through Humana. Is that plan going to be acceptable?
That is a fabulous question for our office staff. They get to handle all of the insurance questions. I get to close my eyes and just take care of the wonderful person in front of me.
You're shaking your head, yes? Okay. Yeah, okay. And then what's the schedule for the staff being on site here?
So still working out a few details, but we will have somebody in the clinic at a very similar schedule to what Jenna and Dr. Usry were available for.
Ma'am, is there going to be some kind of a printout for all of us in independent living to know your official names and everything, the schedule, and just how things are going to proceed? What days you're going to be on site, etc. I mean, we're all very familiar with Denise, who is just wonderful,
Yes.
and so glad that she's going to be here, still here.
I agree. Denise is great. Please feel free to contact her for appointment times. And yes, we do have a little brochure pamphlet that's got our photos and a little background information on us. We didn't have clinic information on there yet, but Denise will be able to put that piece together for you.
Yeah, and then Dr. Fatag, you should have received this information in the mail, in your mailboxes. We also sent it out by groupcast and email, which is an email format, yesterday, and it has Dr. Fatag and Marcia's information on it and their bio, their biography. And then it wasn't on the reverse of the letter? Okay, I'll check. Thank you for that. I'll check with Robin because it was supposed to have been delivered yesterday. And then, so you didn't get them in your mailboxes yesterday, but you should have them in here by the end of the day today. They were supposed to have been distributed yesterday, and it has all the bio information you're looking for. And there is flexibility in the clinic schedule, but Denise is the key person that can schedule any of those and get that paperwork started for you as well.
I might take a moment to introduce Marcia Johnson. She's a nurse practitioner that's been with Generation Clinical Partners since last year. Extremely warm and personable, and I'm sure you're all going to enjoy getting to meet her as well.
Hi, everybody. It's wonderful to see and greet you all today, and I'm glad you all could be here. As Dr. Fatak mentioned, my name is Marcia Johnson. I am an acute care nurse practitioner. I've had the pleasure of being with Generation Clinical Partners since last October, and it's been just a wonderful experience getting to know residents and take good care of these residents as well. I have over 15 years experience as a nurse practitioner. I have mainly served the adult population and dealt with some patients that are very sick, some patients that are not very sick, and I've worked with post-surgical patients, cancer patients, ICU patients, and also patients in primary care and senior care, like yourselves. I am also a St. Louis resident. I have been here all my life, and I've received my nursing and medical training from St. Louis University. I am eager to be able to spend some time with each and every one of you, and to be able to help you the best way that I can and earn your trust.
Well, thank you. Thank you, Dr. Fatak, Marcia, and again, thanks, Lynn and the whole Meramec Bluffs community. I guess right now we could either take some questions. The other thought I had was, we've been in other communities before where there have also been independent living clinics, but we haven't been in this one obviously yet, but we really look forward to starting that. But one of the thoughts I had was maybe during this time together, we could also just hear some thoughts about what's worked really well, what hasn't, what could be maybe opportunities for improvement, if people want to offer any suggestions for us to hear, especially from a medical perspective. But I'd be happy to take questions or direct them to Dr. Fatak or Marcia or Lynn, as the case may be. But I'd just like to open this up now. Mark.
Most of my specialists are at Barnes Hospital, and it'd be great if I could have the blood work done here, because they like it done often, and sent to them. But before, it couldn't be done because they could only be sent to St. Luke's, and they don't have compatible computers on that. So can that be done now?
Yeah, the short answer is yes, but the way it would be done would be the blood work gets run at St. Luke's and then faxed to us as the ordering providers. And then maybe we can enlist Denise's help to fax it to Barnes. So it won't be like it probably won't be in Epic Care Link from Barnes. You're probably familiar with that. Or My Epic at Barnes, because it's going to be a fax. It won't be digital because it's not a Barnes laboratory. But that being said, we do this all the time, and usually providers are fine with getting faxes.
Okay, thank you.
I have a question. As far as the other, we still have what are the other doctors that come here, like the podiatrist, and what are the other ones that, are we going to have the same as before?
Maybe I'm going to ask Lynn to help with that one. Yeah.
Yes, the providers will stay the same, all of it. And 2 or 3 weeks ago, we added the vision. So we continue to add those specialties as well. So those providers are not changing. Dentist, podiatry, audiology, vision. Am I missing anything? Yeah. And then physician, the primary care. Yeah. And those hours are posted. And Denise, by the way, schedules all of those appointments as well. Okay, thanks.
For those of us who have hearing impairment, will we have an account of all that's been going on here, Lynn? It's very difficult with masks on to get word recognition for a number of us here.
Yeah, so what happened is that, unfortunately, the letter that was sent out yesterday that was supposed to go to the mailboxes, I'm being told by texting right now that they did not get distributed as planned. They did get sent out by Groupcast email, and so Robin's going to go ahead and bring some of this down. But this letter, in addition to these bios, will be in your hands today, and that will have a lot of the information on that. And I apologize for that miscommunication on our side.
It's just very difficult to make out words.
I totally understand.
Right, and I do want to apologize for, or not apologize, but explain why we decided to keep our masks on. We are seeing kind of COVID cases go up again in St. Louis. Even people who have been previously infected, we're seeing become reinfected. So, just for everyone's safety, we wanted to try to keep our masks on today. But hopefully, if people have questions, they can always call our office. In terms of that insurance question or any other questions about the transition, if you look at the biography sheet, at the bottom of it, there's the address of our office and the phone number, so you can call that number with any insurance questions or any other questions you might have after this session. And again, just because of the rising number of COVID cases, we decided to keep our masks on today.
I have a question about billing. Like if this is my primary care doctor, will I be billed as I come into to the clinic here? Will there be a monthly bill sent out? And who will the company's name be?
Right. So, I'm kind of like Serena. I'm not on the office side of things, but I know enough to be dangerous here. I'm not sure how you do it with St. Luke's now, but we will not be collecting copays at the clinic. I think how it usually works is we bill the person's insurance, and then if there needs to be any patient responsibility from that, that will come later. But that's how we've worked in other clinics, and that's how I can say that. Yeah.
And we'll have access to a phone number to contact them if
Yes.
need be.
It's at the bottom of the biography sheet, our office address and phone number.
Okay.
Yes. Generation Clinical Partners.
Thank you.
Thank you.
Can we continue to have lab drawn here in the clinic and the result sent out to a doctor that's at St. Luke's, for example?
Yes, yeah. And in fact, my understanding is we're going to continue with the St. Luke's labs.
And I've been getting my ProTime test here. That will also be included.
Yeah, yes, yeah. Yeah, my understanding is the labs aren't changing. And however it's being done now is going to be the way it's going to continue to be done. So, yeah, hopefully that transition will be seamless.
All my specialist physicians are through St. Luke's. For example, Dr. Render's my cardiologist, Dr. Donnelly's my dermatologist. And I know under the current system, they could look up my records from St. Luke's. I assume that you can continue to do that?
Yes, we're not going to be interfering with those relationships, and in fact, we'll be able to work with your St. Luke specialists as the case may be, and not just St. Luke specialists, but also Mercy specialists and BJC specialists.
So you're going to have access to all of the clinic information that was involved up to this point?
Yes, that's my understanding. Lynn's just been great in helping us work with St. Luke's to get access to their electronic health record, and all that information should be in there.
Okay. And then there's kind of a two-way street with the testing and laboratories, one internally and one through St. Luke's. What I'm hearing is that it's still going to remain that way, that you can do it either or?
Yeah, Lynn's nodding her head, so yes.
Okay.
Yes.
Thank you.
You're speaking about St. Luke's. My doctors are affiliated, and all my tests and things are done at MOBAP.
Mm-hmm.
Now, how is that going to work?
Yeah, so we are an independent practice. We're not affiliated with St. Luke's, BJC, Mercy, or SSM. We are independent, and as such, we are free to work with all the different specialists. Yes, yeah, I mean, right. Well, are there any other questions? If not, maybe I'll turn it back over to Lynn.
Hey, Dr. Lynn, Mallory Kiphart here from HR here at Meramec Bluffs. Just wanted to double check. Our staff can currently use the clinic. Will they still be able to use the clinic with your group?
Oh, okay. We haven't discussed that, but we'd have to, yeah. What do they use the clinic for?
They'll use it. They'll use it for like if they have a cold or something like that, like small little things
Okay.
that come up, and they'll use their insurance.
Yeah. Yeah, so I'm seeing nods, so yes.
Okay.
I think so.
Thank you.
Thank you, Mallory.
And with the access to the one of the blessings that have occurred here, St. Luke has been really great to us, and they're giving us access to their electronic health records, which then allows the physician group to back into your records if needed. And then with the St. Luke's lab staying on with us, then that's a continuity of as well. And I know a lot of the staff use the lab part of it more than the physician side of it. It's just easy to go get your lab drawn there and sent to your doctor too. So that's a blessing as well. Are there any other questions before we just informally meet and greet? The information is at the back of the room that has the letter and explaining everything and the biographies. And we will also make sure those actually get delivered in your mail as well, so that you may have 3 copies. You may have one here today, one in your email, and then one on your mailbox, but 3 is better than none. So we apologize for that. All right, cookies and looks like some orange punch in the back of the room. And this is your time to have those conversations with Dr. Lynn and Dr. Faytag and Marcia. And just as a reminder, if you have a medical a need, Denise knows everything there is to know about that clinic. She's our rock and our backbone to that clinic. Thank you for coming today.